Urethral foreign bodies. Foreign bodies may enter the urethra at either extremity or may develop in and about the canal. From without, fragments of surgical instruments, substances introduced by the intoxicated, insane, or sexually perverted. From within, renal or vesical calculi, or any substance which might form a nucleus for such calculi. Stone, originating in or about the canal, formed about a foreign body or in an ulcerated spot, pocket, or fistula. Prostatic calculus. Varieties. The most varied substances are found in the urethra, introduced by the patient under the influence of that perverted and depraved sexual instinct which affects the male of all ages who gives up his mind to impure thoughts and whose sexual necessities are not gratified. Seeds, stones, beads, beans, peas, nails, pins, needles, hairpins, slate pencils, portions of glass, wax, cork, and a host of other substances are thus introduced into the meatus and, slipping beyond the reach of the fingers, are not infrequently swallowed by the urethra. Broken catheters and bougies, especially in cases of stricture, and instruments left à demure, if not well fastened, may slip past the meatus and travel toward the bladder. Their tendency is to slip persistently onward, not because of any urethral suction or peristalsis, but merely because they are introduced blunt end first, and consequently, unless quite round, the outer end is likely to be the sharper. Therefore, every erection or effort at extraction, if it moved the foreign body at all, pushes it inward. Rounded bodies, such as beans or pebbles, lie in the natural pouches of the canal, fossa navicularis, bulbous urethra, or become arrested by stricture. If foreign bodies are not removed, one of three consequences follows. 1, they travel on into the bladder and form a nucleus for stone there, or 2, stone forms around them in the urethra, or 3, they cause urethritis, retention of urine, and finally either become encysted or ulcerate their way out, producing fistula and stricture. Treatment. If the body be long and soft, catheter, piece of wood, it may be transfixed with a stout needle through the floor of the urethra and the canal pushed back over it, like a glove over a finger, as far as possible, where it may be transfixed again, and so urged forward until it reaches the meatus. In manipulating with forceps, if the finger on the outside can detect and get behind the foreign body, nothing should divert the surgeon from keeping up pressure at that point in order to prevent his instrument from pushing the offending substance still deeper into the canal. If the foreign body lies behind a stricture, the latter must be cut or rapidly dilated to allow the passage of an instrument suitable for extraction. Pins and needles may be extracted through the floor of the canal if their blunt ends can be steadied. To remove a pin, its point is pushed through the urethral floor and its shaft drawn out until the head can be turned so as to extrude through the meatus. My father once extracted a pin with Thompson's divulsor, and Diefenbach removed one from the membranous urethra by pushing it with his finger in the rectum until the point protruded through the perineum, and then forcibly extracting it. All other manipulations failing, perineal section will reveal the position of the object and permit extraction. The penile or the scrotal urethra should not be incised for fear of fistula in the one case, infiltration in the other.